This is kind of a two-part question for both Dr. Chan and for you. What do you think is behind the spike in numbers that we're seeing right now? And is there anything in particular we can do beyond what we know about guidelines? And given that, is the state considering or reviewing any of our current guidelines or considering any further restrictions, whether on travel or businesses opening or closing?
Yeah. So I'll kind of take the first part, and then I'll have Dr. Chan kind of fill in the blanks, if you will. So let's talk, I'll kind of jump into the last part of your question first in terms of the guidance and guidance documents. So our Reopen New Hampshire committee continues to meet with stakeholders, working with public health, looking at our numbers, they're the ones that really help design and kind of do that first step on the guidance documents. And they're always bringing recommendations, but not just to open things up, but also where to potentially find better structure around where there could be a direct outbreak, an industry-specific issue that might be sparking up. And so the fact that our contact tracing is so specific allows us to be very, I'll use the word surgical, if you will, very precise about where we can, I think, tighten things up or just create more opportunity. The best example to date was probably hockey, right? We said, okay, well, we could see a lot of outbreaks specifically in that industry, so we looked at the guidance documents there, pulled back a little bit, took a pause, reworked the guidance documents, and again, kind of re-release them, get their season going again in the hopes of allowing that to continue in a safe and healthy way for the kids and the parents and all those that are involved. In terms of the numbers going up, there's a variety of reasons for that. It's everything from, it's the fall. We always talk about in the fall, the flu, the cold, COVID, the viral spread is just going to move a little faster and more aggressively in the fall as our immune systems become a little more suppressed. I'm always very serious when I say, look at whether it's taking additional doses of vitamin D or vitamin C or whatever, zinc, all those things that help boost our immune systems during these kind of smaller or colder and shorter days part of the year when you don't get much sunlight, we're not out as much. Obviously, as we go indoors more, we're just spending so much more time indoors. That clearly is playing a factor. The fact that schools and universities and just there are more gatherings for one reason or another. And again, that's why we're constantly telling people wear their masks, maintain the social distancing, wash your hands, good hand hygiene, most important tools that we have in the toolbox for all of this, and we're going to keep that at an elevated level. As we move forward, I can say if we were, because we can be so precise, we can be very precise not just as an industry or a school or whatever it might be, but we can also be precise by a region, right? If we see numbers sparking up aggressively in Hillsborough or Rockingham or one county or the other, if we had to take additional steps, we can also, I think, because we just know more, have more tools in the toolbox, as I always say, we can be more precise regionally about any additional measures that we may take. I think at this time we're always looking, we're always reviewing everything in terms of when the numbers come in the morning. I take a look at it. I work with my staff. We work with public health a bit in terms of where the numbers came from, if there are patterns, if there is history from, are they mostly long-term care facility based? Are there congregate settings, additional congregate settings? Are they in the schools? Are they in the universities? Contact tracing does a tremendous job of really outlining for us internally where all those numbers are. And if there are patterns and numbers building up beyond what we think is manageable or expected, then of course we can take additional action there. But that's my long way of saying hats off to our team for being so good about being able to follow up with a lot of this, getting us the data so we can see those potential trends and anomalies in terms of what was expected. But I'll turn it over to Dr. Chan.
Yeah, thank you for that question. And let me say that we know how this virus spreads, and we know how to prevent this virus from spreading, right? We still believe that this virus primarily is transmitted between people through close contact to a person's respiratory droplets. And so what we have seen over the course of this pandemic is actually the epidemiology, the risk factors have also transitioned, right? Early on in this pandemic, in March, April, May, many of the cases, many of the infections that we saw were associated with either travel or with outbreaks, particularly outbreaks at long-term care facilities. And what we're seeing now is that the transmission and the spread of this virus has largely moved out of those facility outbreak settings and into the general community. We're seeing more people that are being identified who have been in close contact as a risk factor for acquiring COVID-19. We're seeing more introductions of COVID-19 into various settings, which is keeping our contact tracing team busy. And so I think the bottom line is that we know that this virus spreads through close person-to-person contact. We know how to prevent it from spreading, but it requires people adhering to the social distancing recommendations, the cloth face mask or face mask recommendations. But more than that, that this is a virus that likes to take advantage of crowds, groups of people gathering in close contact in indoor spaces. And it's those settings in particular which are going to increasingly pose a challenge as we enter the colder months. People are gathering indoors more. People are getting tired of the pandemic, wanting to get out and socialize, be with family and friends. And so it continues to be a struggle. I think putting the message out there and having people hear that they need to continue to limit social interactions and avoid getting or being in situations where there are groups of people in close contact in indoor spaces where this virus can spread very easily. And I think that that's one of the major challenges that we're going to face going into the winter months.